Thanks so much. Just for some history, Dan approached Glenbeigh first, and if you don't know the story, Dan came to the business office. I was in the main hospital, and the message was that there's a guy here who's interested in starting a golf outing, and all the funds would go to Glenbeigh. Now, rumor has it I ran so fast that I knocked over an older patient in a walker. That isn't true. The person was in a wheelchair. It wasn't a walker. But I ran so fast, and that really started ARCHway's mission. We started a golf outing, and it's been a great partnership with ARCHway, and it's a pleasure to be here. Just for people who don't know, Glenbeigh is a nonprofit affiliate of the Cleveland Clinic. We've been in business since 1981. My career started at Glenbeigh in 1983, and we've grown to have now over 190 beds on one campus. That includes from detox to long-term treatment for women. Our most recent recovery residence is a women's house. Glenbeigh provides the entire continuum of services from detox all the way through. We have a total of about 300 employees, and we go back to our roots, 1981. We're an abstinence-based program. We definitely support the use of Vivitrol, but we do not prescribe our patients any other Suboxone or methadone. When I think back to March, early March, we had 170 patients the day the pandemic hit, and a lecture hall that fits about 156. Social distancing and all the things we're now being told were very difficult to move forward. Since that time, lots and lots of changes have taken place. We have about 60 to 70 less patients every day. We've separated males and females from lectures, and we've done hosts of other things, including on Monday, we began to actually have the COVID test done last Monday. So every patient is given the actual COVID test on their first day of admission. It's been challenging. Patients in an inpatient setting don't really understand or very mindful, which has caused concerns of staff and other patients about social distancing, eating together, shaking hands, all the rest. But over time, as I've told people over and over, I have learned to dance in the tremendous hurricane that I think we're all in. And in a couple months, I'll turn 65, so I'll be in one of those age groups that puts me at higher risk. I don't know if God then determines you to be at higher risk when you're real close to 65, but all of us have had some personal and challenging things. One of the things we did early on is we developed a virtual meeting site, and 7 days a week, we invite people to come and join in. The alumni coordinator was also a radio host and has done a wonderful, wonderful job of inviting people and engaging people in a variety of recovery topics that has been well received. All of our outpatient centers went telehealth somewhere around March 20th. I think we're all believing that this is good, but it truly isn't what we're all used to, nor do we believe that it's as good as meeting in person. People ask you, so what do you think will happen in the future? I believe that we will be seeing a much, much higher degree of alcoholism as the primary drug of choice. That based on our recent admissions, alcoholism still is going to reign as the #1 drug of choice. I think we see that there's going to be a lot of positive things that come from opportunities of telehealth. I really believe that staying connected with our alumni, with current patients, following up, will never end. This is truly one of the great silver linings of this pandemic, is the realization that staying connected is such an important component, and doing it like we're doing it now is happening. The state of Ohio, limited so many of those things that didn't permit people to have AA and NA meetings, so all of them immediately stopped. So one of our real challenges in treatment is to educate and orient people, especially those who had been in recovery before, what it's like when you leave and you go back to your home and all of a sudden you're not eligible, you're not able to go to any meetings. And for those that have had long-term recovery who know what it takes to stay in recovery, all those things have to be relearned. The idea of sponsorship, of having a coffee together, of going out to dinner after a meeting, to go to a breakfast before a meeting, all those things that so helped and supported people's long-term recovery, all of those have to be done a different, safe way. My hope is that, over the next few weeks, that we will, in the great state of Ohio, allow for more meetings. The Commonwealth of Pennsylvania allows now meetings up to 25 people. This is truly, I tell people it's kind of like flying the plane as you're building it. It's scary, and yet I'm of the firm belief that through this process that we will continue to witness miracles as we've done in the past. Seeing one of the things that was most rewarding for us is the resilience of the patients who started in March and progressed to a level of now being ready to go and leave. And they were so grateful that they actually unexpectedly produced some posters that they left at the main lobby and at the nurses' station. And then a band of them went to every office, masks, of course, every office, expressing their gratitude because they recognized that being in a safe environment right now was the best thing that possibly could happen for them, and the gratitude that they expressed. Patients, I think, were equally or more receptive to staying in treatment than some of the staff who, because of health issues or fear of bringing this COVID virus home, had. Patients are resilient. Recovery is a miracle, and I'm glad you asked me to speak.